Welcome, everyone, to Caregiving, supporting someone you love and yourself during breast cancer. My name is Lynn Folkman-Auspitz, and I am the Manager of Community Engagement at Living Beyond Breast Cancer. I am happy today to introduce Greg Garber, who will be joining me for our discussion. Greg is Director of Oncology Support Services at Sidney Kimmel Cancer Center at Thomas Jefferson University in Philadelphia. With more than 20 years of experience as an oncology social worker, Greg has worked extensively with people diagnosed with cancer as well as their families, helping them better the quality of their lives before, during, and following treatment. And you can read more about Greg on lbbc.org. And thanks so much, Greg, for joining us. So let's just jump right in.
Great. Thank you.
So we may all have an idea about who a caregiver is, and I'm sure in your work you have seen a variety of caregivers. I know for me personally, my sister was my caregiver when I was diagnosed with breast cancer, but thereafter, or before that and during, I was also a caregiver to my parents. Mm-hmm. So let's talk a little bit more about who is a caregiver.
Well, a caregiver can be any one of a number of people in one's life, and there's really no, no criteria other than somebody who is interested in helping one get through an experience. So it could be a family member, it could be an adult child, it could be a coworker, it could be somebody in one's faith community. Really, it's kind of broad and wide, really relates more to the desire of one to help somebody else navigate an experience.
So part of that experience may be of giving back even, or helping someone that you love, no matter what that relationship may be. And I guess, are there certain characteristics that are really common to most caregivers?
Yes, I mean, I think we all can kind of pick out the people in our lives who are caregivers. They're the ones who are kind of bringing meals when something goes wrong, or reaching out, remembering birthdays, dropping something off from the store, asking if you need something. The people who are kind of very attuned to the feelings of others and wanting to be helpful as it relates to that. And I don't know what the exact definition of it would be, but I think it is a very, very broad group of people that can come from surprising places. It's not always a partner or a spouse or an adult child. It can be an old friend from school. It can be, someone from work or somebody that you don't even know that well. And I think that kind of, for caregivers, as you said earlier, I think that this becomes a very nice complementary or bi-directional relationship that works for the patient and for the caregiver. It creates a nice synergy and an opportunity to work together towards something.
I think what's so interesting is saying people can surprise you of maybe things people that you wouldn't necessarily think of a caregiver. And sometimes even, I'm going to say the flip side, sometimes maybe that you think people would be. Maybe you're not.
Absolutely. I think, Lynn, that's a great point. I think the takeaway from that point is kind of, look around and see who is stepping up. And those are the folks that are the ones with whom you may want to connect as you're going through an experience like this. And while there will be others who are disappointing or didn't behave in a way that you thought that they might in this situation, there are often many others who do, and often it can be surprising to try and sort out who those two groups will be before you see it happen.
Mm-hmm. So I just read some recent research about caregivers that stated that 1 out of 5 spend 100+ hours per week of caregiving, and that 4 out of 10 reported declines in their health. How do you see, with the caregivers that you work with, how are they affected both physically and emotionally in the roles of caregiving?
Right. I think it's a great point, and it's a great question. caregiving is an extraordinarily emotionally and physically and time demanding process. And unlike kind of caregiving for somebody, say in an acute post-surgical event, or if somebody had their wisdom teeth out or an orthopedic surgery, caregiving with breast cancer often goes on over a long period of time. And so not everybody is thinking at the beginning that I need to pace myself and I need to kind of think about how I want to approach this and I want to integrate self-care. It's truly comes from a great place of just wanting to be available. And often by the time people start to break down a little bit, it's hard to course correct in that. So certainly there are tremendous opportunities for a lot of gratification, but there are tremendous opportunities to really go kind of outside of the realm of like comfortable with putting your own needs aside. The challenge or the rub is that a caregiver is going to be less and less useful to the patient for whom they are caregiving if they are kind of exhausted and burned out and not feeling well themselves. And so the idea of pacing oneself from the beginning becomes really important in that. And we see this all the time in all kinds of cancers where the trajectory of illness can be very, very long, or treatment can be very, very long. And most people are not experienced with that. So they kind of get in with fabulous intentions and can get in over their head and get exhausted very, very quickly.
Yeah, and it's almost like sometimes you don't know how exhausted you are until you're really deep in it.
Right.
And those signs that come up.
And are developing distressing symptoms. You're not sleeping at night, your family's getting angry with you, you're not getting things done that need to get done, you're feeling overwhelmed. I mean, there are many, many kind of signals that it's time to take a step back and take a look. When possible, it's good to share the caregiving role, and not everybody's thinking about that at the beginning, but people can have multiple caregivers for multiple different things, and kind of dispersing some of that responsibility and some of that intensity can often be really helpful.
And that was actually going to be my next question in regards to those. What are sort of the tensions and the stressors of caregiving that come up in relationships?
So, first of all, caregiving for somebody going through cancer is not necessarily a natural role for somebody. So it requires a role change. If it is somebody who is close to you, it changes a relationship dynamic. It is, this may not, this is your partner, but this is also the person who is now taking care of you. And as we know in adult relationships, there's a mutuality in there. And this can change that for a while and can be difficult and frustrating. Caregivers often can take on the distress of the patient and feel even more distressed than a patient does. Patients often have a tremendous amount of structure going through cancer therapy. There are appointments, there are treatments, there are things to do, there are medications to take, there are all these structures that exist that help scaffold some of that anxiety. For caregivers, not so much. We really don't create an awful lot of structure around that. People just kind of do what they feel is the right thing to do, which isn't necessarily a bad thing, but that can be absolutely exhausting without having much structure around that. Feeling out of control, feeling intense desires to fix things. It's hard. You're often caregivers are not oncologists, and they're learning a whole new language along with the patient, and a whole new treatment system, and that is stressful as well.
And I guess what are some of the maybe more positive opportunities that come up when there's a caregiving relationship? We sort of talked about some of the stressors, but what are the positive things maybe that happen?
Well, I mean, being a caregiver is a fabulous thing. I think one of the things that people around one who is diagnosed with cancer feels is powerlessness, is feeling kind of wanting to help but might not know how, is feeling frightened. And caregiving is something to do. It is helpful, it is useful, it provides a need. It is and that need can be physical, it can be rides, it can be emotional support, it can be taking notes at doctor's visits, it can be going to grocery stores, it can be cooking meals, it can be walking animal pets and stuff. So there are lots and lots of things. Caregiving certainly meets a need for people, a good need for people, and it is wonderful when people have those qualities. And so, it is certainly more of a positive thing than a negative thing. However, when the kind of the more challenging aspects of caregiving start to surface and people are a bit surprised by that, it can make it a little more difficult to kind of figure things out. And I think the more education that we can give to kind of caregivers at the beginning of the process, and kind of level set with expectations, I think the better that everybody does.
Yeah. So in your experience, are there certain strategies that you can share that which make the caregiving effective for the patient? And I would then also say on the flip side that make it effective for the caregiver.
Yeah, of course. I mean, I think that's also a great question. And I think certainly there's some overarching themes, but really also depends on an individual and their needs. Some patients have a tremendous need for information and like to be part of everything and are have strengths in certain areas, and some would prefer to have other people do things and help them out and are more comfortable letting somebody take some of that control for them. And I think one of the best early conversations to have is kind of, how can I best help you during this? And here are some thoughts that I have, because you want to put a little structure around it, because a patient may not know. And there are many, many ways to be helpful, as I mentioned kind of, in an earlier question, but going to doctor's visits, watching children, being a sounding post, calling other friends and disseminating information, kind of where do you see the needs kind of as this evolves? And let's talk about that as this goes on, as they change. And when this becomes a one-sided relationship is when it gets into a little more challenging territory. Caregiving is a role and being a patient is a role. And the more kind of communication about the needs in that will portend for kind of better outcomes and, kind of being in it for the long haul a little bit more easily. And caregivers, kind of empowering caregivers to say, hey, here's what I'm able to do, and here is when I am available, and here is when I am not, and kind of making some rules for oneself in going into that role, and being kind to oneself and saying, listen, it's okay. I'm making a choice to be a caregiver, but I'm also kind of within that choice, I'm making a choice to take care of myself as well, kind of recognizing that if I don't do that, it's not going to be good for either one of us.
Right. And it's hard sometimes, to really bring that balance. And I think your point of, it's so interesting because everyone brings who they are to the relationship.
Correct.
And everyone, and it reveals itself.
Yes.
And I think that to even just that simple question of what works, but sometimes that's a difficult conversation to have. And, I know, for instance, I'll share something a little bit about my sister. My sister's a former nurse. So she came from it from really a nursing perspective. Right. And I came from it where it was like, what's just right in front of me? What's the one thing I need to know right now to do? So I think just remembering that everyone comes to it differently with who they are.
Most certainly. And kind of that your sister is a nurse, I kind of think about when we care for healthcare professionals who are diagnosed with a breast cancer, we it's interesting. We often stop doing what we know how to do because we think they know, rather than having the conversation about how we can be helpful. And I think it's just really critical because, this is cancer is certainly a novel situation for many, many, many people, and not one to which we bring a vast amount of prior experience or knowledge. So, no matter where somebody comes from, should certainly always be a conversation, and there should be opportunities to course correct, and say, hey, this is what I need. I thought I needed this, but it seems like this feels helpful to me. This feels more of what I need now. And I know, like we're having a conversation in the abstract of it right now, and in the real world, things are a lot messier. But kind of starting with some framework and starting with kind of making efforts for conversations about this relationship is certainly a good place to be.
Yeah. And as you said too, I think sometimes you go in and you don't know what you need or what you want, and then to really say, then that changes too, and just to continue the ongoing conversation. So I know we talked about really why self-care is so important to the caregiver. But what maybe signs come up for the caregivers that they should really be aware of, that to say like, oh, I really need to take better care of myself?
Yeah, so that's a little bit different for everybody. People's stress manifests differently. There are some people who stop sleeping as well. Some people who are feeling more anxious. There are some people who are kind of feeling an impulse to stay away. There's kind of loss of interest in things that you typically had interest in. There are others around you asking you where you are. I think that this is, very unique. Feeling angry at yourself, at family members, at the patient. There could be guilt that you aren't helping enough, or that that you're healthy and the person you're caring for is not at the time. And I think there's this kind of like persistent challenge of feeling like one is doing what they can, but they're not relieving suffering, which is kind of a very lofty goal. And so, I often will ask people when I meet with them first time or in the first couple of times, tell me, what are the signs that you're having a hard time? Like, what does that look like for you? Do you stop reading? Do you, stop going out? Not that anybody goes out now, but what do we need to look for? And kind of bring that up and get that conscious so people can be aware and check in with themselves or check in with somebody else about the emergence of these things.
And if someone is seeing signs and they know their own signs, how do they go about getting, like, what should they be doing, and how do they go about getting support for themselves when it's really maybe hard to pull away from the people that they're caring for?
Yeah, it's a great question, and I think there's been a tremendous increase, in no large part due to LBBC, in the kind of role of caregiving and how to care for caregivers. And there are tremendous resources out there, and everybody kind of finds support in different ways. Some people do yoga, some people go to a support group, some people talk to a friend, some people speak to a therapist or a counselor, and some people go away. I mean, there are a variety of different things. I think kind of the most important piece of that is giving oneself permission to do that, to be kind to oneself and say, hey, I'm feeling a little rough right now, and I need to kind of figure out what I can do to kind of sustain myself a little bit. And in that process is kind of identifying others who can and possibly help out during that time. I think some good strategies kind of going as a caregiver is really kind of recognizing right from the get-go that caregiving is an imperfect process. Everyone makes mistakes, and just be good to yourself. And those of us who are parents have also learned that, sometimes you need to let the smaller things go for the greater good and for conserving some energy. Finding some time for yourself, just quiet time where you're not answering your phone and looking at your email and being stimulated in so many ways. And I think the same thing that works for patients also works for caregivers is maintaining structure. It may look different, but structure is the great leveler of anxiety, and caregiving can really tear down structure very, very quickly. But even within a caregiving role, one can still have structure. And I think that that's important to pay attention to, whether it's meal times or recreation or things that we do. I also always like to kind of tell people to think about like the short, intermediate, and long-term goals. Like, what is it I can do for myself today? And what can I do for myself in the next couple of weeks? And what can I do for myself in the next month or 2 months, rather than kind of creating a lofty goal that I'm going to, pick up a mindfulness practice, and I'm going to, go to a retreat, and I'm going to stop answering my phone between 6 and 10 at night. I think those lofty things tend to result in failure. And when goals are more reasonable, they tend to be more achievable. So like, I'm going to go to bed at 10 o'clock 3 nights this week. It seems to be reasonable, right? I'm going to eat dinner at 7 o'clock, whatever that might be, or I'm going to watch this show with my partner, things like that.
Right. And as simple as maybe I'm going to sit and have a cup of tea today, or whatever that is.
Correct. Exactly.
I think, thank you so much for saying, sort of the feelings that are normal, having maybe guilt and resentment and anger at times. And those, it's okay to feel that way. How does, sometimes in a caregiving relationship, I think that caregivers know best or think they know best. But they get frustrated by maybe the person's not doing what they think they should be doing, or what's best for them. How do they balance that for someone that they love and care about so very much?
Right. And I think that can begin with a conversation. It depends on the relationship, but I'm a therapist, so I'm going to say it in a different way, but I feel like I want to be helpful to you. And there are a few things that I see that potentially could make things better. Tell me how I can do this. I think the more that people are talking to each other, the better that goes. And I think part of caregiving, inherent in caregiving, is like the ability to put one's needs aside, and whatever those needs may be, the need to provide information, the need to take over, the need to take care of, kind of figuring out where you might need to contain yourself a little bit and say, okay, this is something that I do not have control over right now. This is a choice that the patient is making. I may not agree with it, but getting into it with this person, if it's not something that's going to cause peril, may not be worth it right now. There are also kind of good times and bad times to talk about stuff that's a little more charged. A bad time is when things are charged. A bad time is in the middle of a crisis. A bad time is when you're feeling an urgency to talk about something. A good time is when things are quiet and there is some calm, and when it is not in the middle of an infusion center or a doctor's visit. Often timing of kind of conversations and things like this can make a huge amount of difference. People are kind of accommodating a tremendous amount of anxiety, both patients and caregivers and providers. I mean, I think it bears mentioning that we're kind of living in the midst of a pandemic right now. And I always have to remind myself that in addition to the anxiety of illness and caregiving, we have this background amount of anxiety that walks with us every single day. And while many of us have adjusted kind of well to that, it isn't going away right now. And so having some recognition for kind of the components of what your frustration might be at the moment.
I think I'm going to say, when you were saying that, I want to say it's just such wise advice, because it's universal. It maybe is not just for caregiving, which is great for caregiving, but
Right.
it's such wise information to remember right now.
Yes.
So thank you.
We all need to be kind to ourselves. These are extraordinarily difficult times, and people are truly doing the best that they can. And so, the goal is to get to the other side of this as intact as we possibly can be. And towards that end, there are a lot of different ways to do it, and need to find out what works for each one of us.
Right. So we've covered a lot, and we've talked about really some great information. Thank you so much, Greg. So as we close, if you maybe had one of your biggest takeaway for caregivers or advice, what would you tell them?
I think, and it may sound a little trite, but I really think kind of reminding yourself that caregiving is an imperfect process. It is something that you will make mistakes about, and something that you will have feelings about. And the feelings may seem untoward, like getting angry at somebody, or feeling guilty, or feeling like you want to abandon somebody. And it's all okay. Like, we are human beings in this kind of really difficult process, and kind of volunteer to help somebody get through a tremendous challenge in their life, and be gentle on yourself, and kind of allow yourself to some of this stuff to roll over you. It is not a commentary on you. The commentary on you is that you are a caregiver, and that you are kind of giving of yourself in this, and it's okay to be messy, and it's okay to say you're frustrated. It's okay to take a time out, and engage in self-care.
I don't think that's trite at all. I think it's really important for people to remember. And sometimes when you're going through a stressful period, sometimes it might be hard to just remember those things that you just need to keep reminding yourself of. So thank you. So thank you for watching today, and thank you to Greg Garber for sharing his expertise. We ask that you give us your feedback on this on-demand session, and on your overall experience with this virtual conference. An evaluation will be mailed to you on Sunday. Please take a few moments to fill it out and share your comments with us. We read each and every one. And thank you, and take care.